Welcome to a Day in the Life video series from your therapy source with your host, Margaret Rice.
Hi, everybody. Welcome to our video series, A Day in the Life, where I'm going to be interviewing lots of different people, OTs, PTs, teachers, parents, and see what their day-to-day routine is like. So today I have Stacia joining us, and I think I'll just start off by asking you to tell us a little bit about yourself and what you do, Stacia.
I am an occupational therapist, and I've been practicing for 33 years now, full time.
Wow.
I don't have any children of my own. My kids I see are my children. So I guess I would say I have probably over 1,000 plus
I would
children
think, yeah.
over the years. I do own dogs, big dogs, mastiffs. And in the past, I've used them in therapy with me when I owned my own practices. I owned one practice and I used to bring them in for private practice. I started in the school system, went to a teaching hospital, then into private practice and back into the school system now. So I've done everything pretty much.
That's amazing. Super cool. Can you share more about how you moved from location to location and more about that journey? Because that's really interesting to me.
I started off in the school system right out of OT school and just didn't find it as a good fit because I was isolated. And I felt I needed to be around more therapists with experience. So I was able to get a job at Shands Teaching Hospital in Gainesville, Florida, which provided me with a huge background of every diagnosis you could ever imagine. And I worked in, every floor for pediatrics. And I've done pediatrics the entire career. And I did every clinic. I did the craniofacial clinic. I did barium swallows. I did brain tumors. I did the cancer floor. I did cardiac intensive care unit, pediatric intensive care unit. I did the bone marrow transplant. I've done all the floors, everything in the teaching hospital. And then I moved to outpatients for a while.
And this was all pediatrics.
This is all pediatrics and pediatrics only. And
very amazing.
It was phenomenal. And the experience I gained and the knowledge of children and diagnoses and parents and what they go through. And the biggest experience that I gained was doctors don't like to give parents bad news. And that was oftentimes, especially when I was an outpatient then, my job to inform the parents, something's not quite right. And here's what I'm seeing. And it was hard because I was still only 5 years out, maybe at that point. What was very beneficial was we started up at a program with the residents where the residents must follow the OT, a PT, and a speech for 3 days each around for the entire day, for 3 days for each profession. And it gave them a better appreciation, and we no longer were getting prescriptions that said for diversional activities. For an OT, that's great because we don't do diversional activities.
Right.
In the teaching hospital, I also learned to evaluate skills very quickly because the teaching hospital acute care, you're going to have a kid come in. They're going to be there for maybe 2 days. You have to get a treatment plan, find a facility or some place to treat them when they get out and give them a plan, and out the door they go. So that was very quick turnaround, except for the intensive care units. But I would follow them up, and I still have contact with some of my kids that I saw there, and that was back 91 to 97. So
wow. So that was a long time that you were there.
It was
gaining
a long
all
time.
That experience.
Yes. And I stayed there in Gainesville and worked at a clinic that specialized in learning disabilities and ADHD and sensory integration. And I was trained in the Linda Mood Bell visualizing, verbalizing. And the kids would go there for 5 hours of that and 1 hour of sensory integration. And it was invaluable there too. And it was owned by a developmental neurologist. And I learned about the medications and the value of them and how in how invaluable it is to have the 3-month med checks, and that medications do work when they're monitored correctly, and they are based upon height and weight, and that's why it's needed every 3 months. And these are things that people don't understand, but if you are educated, it works. And most of my life I had been very active, but at that job I'm sitting, and I was going crazy. And
So you went from so you were in schools, then the hospital, then to this private practice that was, you didn't own it, but run by somebody else.
run by
where the
someone
focus
else.
was learning disabilities, but that was more of a sitting
Yes.
job. But you learned a lot about that
Yes.
group of kids, which is
Yes.
interesting, just what you said about the medications, because that is really important.
It is. And because I was sitting, I couldn't focus. And we realized I was ADHD, or am ADHD. And it took a while. And when talking to the physician who owned the practice, she looked at me, she said, I was wondering when you were going to come to me. And now, as an adult diagnosed with ADHD, again, it's very valuable to understand this aspect of it. And I am very open about it and tell people, if I'm not on my medications, you don't want to be around me because I don't function as well. And I always tell parents, if you don't know or don't think it's going to be right, ask for a placebo trial where only the doctor and the pharmacist will know. And keep
Interesting.
track.
Right.
And
interesting.
that way you can, have the teachers track on an hourly basis. Are they attending? Are they focused? Are they fidgeting? A 0, 1, 2 scale, very simple. And have them, write it down every hour while they're at school. And you'll see if it's working or not. It's very simple. And
that's very interesting. I've never heard that perspective before, but it's kind of mind-blowing to me right now because it makes so much sense. And you're right, it is simple, and sometimes we don't see the forest through the trees, especially when you're saying have those teachers, record every hour, and parents, and only having the doctor and the pharmacist know, because there is a placebo effect. This we know from research.
right.
And so that is an interesting way to start off, because not all kids will benefit from medication.
Not every medication works. We know some meds work for kids who have sensory issues, and some absolutely do not. So if one medication doesn't work, you need to see maybe there's something else. Just, I tried meds, it doesn't work. So
really exploring, collecting data, taking a real close look at what you're using to determine what's best for those kids, each individual child.
Yes. And I mean, Adderall is a salt base, Ritalin is a stimulant, and it just depends on what the child is lacking chemically inside their brain to work. And I always ask parents, would you not let your child have their glasses that they need to sit in the class and read?
Right. Saying along the same lines, that if it's helping the student. So you worked there, got tired of sitting. The job was not for you after a while, but you learned a ton, it sounds like. And then where did you head?
Then I started my own practice.
Wow. Okay. Keep going. I love this.
And it was very eye-opening, and I loved it. I had a great time. And the biggest problem was getting parents to pay their bills. And I hate to say it, but the worst payers were other professionals who had their nannies drop them off and they never paid. So I'm not going to mention those professions, but they didn't pay. And I ended up having to close my practice because therapists, we help. We're trained to help people. We are not good bill collectors on our own.
Definitely true. You would be amazed at how many purchase orders I have open because I just never go back and feel like dealing with it. So I totally get that.
It is very hard. So I always said, if ever I did have another practice, I would have a separate business manager to do all bill collections. And that's my biggest advice for anyone thinking about doing their own practice. Get someone who's going to do the billing and collections, because it's not easy to do.
Now, were you all private pay?
I was all private pay.
Okay,
and
that makes it really hard.
And I went to classes on how to do the coding and billing and all of that. And most of the parents wrote the checks, they got reimbursed. And at that time, this was back in 90s, 2000, 2004, 2000, 2000, somewhere in there. I can't even remember the date.
Early 2000s,
Yeah.
early 2000s.
And at that time, insurance companies would take 6 months to pay a provider, but they would pay their clients like in 6 weeks. So the parents were willing to just wait 6 weeks to pay me when they got reimbursed. And that was fine with me. And they would do it, most of them. But, so after not being able to make it, being a single individual, deciding which bill do I pay on my own, my power or, mortgage, and scrimping and scraping. And I had a waiting list for me to see me. I had a great clinic. It swings, obstacle course set up, everything fabulous. But I just couldn't do it.
Yeah,
And
being a collector was not part of your job description.
No,
yeah.
and I'm not that kind of a, at that time, I wasn't that mean, strict, harsh, boom. Now I could do it. I got no problems now.
Right. It's funny how as we get older, there's things that we could tackle that we couldn't tackle before.
Absolutely. So from there, I closed the business and moved from Gainesville, Florida up to Atlanta area here where I am, and started working for some different private practice, and just helped, and eventually with one practice build it from a small area to, and I literally walked in, sat down and said, you can't afford to not hire me. And she looked at me and she goes, wow, that was the ballsiest thing I've ever heard say to me. And I said, well, I'm going to come and have a whole caseload to bring to you, and then more people will come.
Right.
And literally within 6 months, we were moving out of the small area and into a space close in the same area, but triple the size. And we did it. And then,
that's awesome.
And then I decided private practice, contract, you're getting older, Stacia, your body doesn't hold up. And I've done sensory integration therapy. Back when SII was around, I was SIP certified.
Okay, yep, I remember those
I've
years.
gone through NDT training, myofascial release, craniosacral, Beckman. I've done so much, and little acronyms and everything around me. But retirement and paid time off. And my mom was a teacher for 40 plus years. And, I think I want to go back into the school system now. I've got enough under my belt. So I am now in the schools, and this is my 8th year in the school system. But that was a tough transition.
Tough transition. Why? To get back into that whole mode of educational related services versus medical model? Okay.
Yes, huge difference, because I'd been in the medical model for 24 years at that point, and it's totally different. So things I'm thinking, oh yeah, we need that, and it's like, no, we don't do that. That's not educational. And recently I was talking to one of the 2 lead therapists. I said, this is my 8th year in the schools, and I still feel like a new therapist. She goes, but you've got 30 plus years. I said, but it's my 8th year in the schools.
Right.
And I feel like a new therapist as far as the academic educational model goes. So I still am learning and going to more conferences for the educational OT based. But as a therapist, clinically, I have no problems. And this year I'm taking off in my school that I am with 4 of my self-contained classes, and we're doing these new model within the class where on Mondays and Tuesdays I'm working groups and lesson plans with the teachers, And then they're going to continue with the activities that I'm doing.
Oh, that's excellent.
In their plans through the rest of the week. And then I go back for the kids on Fridays and do data collection. And I've got special worksheets that we use for their actual goals. And so we sit down and we make sure we're scoring them correctly for inter-rater reliability on their goals and progress. And sorry, one teacher, and I did this last year for a good part of the year, and all the kids met all of their OT supported goals.
Wow, that's awesome.
So that was my lead in to say, this is how we're going to do it for the 2 MI classes, the kindergarten special ed and the preschool full day special ed.
A much more collaborative method than just pulling a kid out for 30 minutes a week or pushing in. It sounds amazing. Now, how do you, out of just the logistics of that, how are you writing minutes on an IEP?
It just depends on, we have a, what's with the CERT, it's a criterion educational relevant therapy rubric.
Okay.
And so it's based upon how the kids, what goals I'm supporting, and their time comes out according to that. And so when I go in and I do the goal, I do a group, it's for the whole class. I'm not going to isolate out a kid who doesn't get OT. And right now, my younger in my class has this year they're going to have pretty much kindergarten first and 1 second grader. So we're going to be focusing on a lot of pre-writing and cutting skills. And that's where the teacher, because last year we had 1 kindergarten, 1 first grader, and second, and they actually threw 3rd grade in with her. So they were all on upper skills, and those 2 little kids didn't have, I mean, they were swimming, and I had to really change and focus for them in a different way. So now it's reshifting for she and I, and she's the one that I structured this with. And so we will really get a start at the beginning of the roots of learning how to write handwriting again. And of course, we know we don't teach handwriting in the curriculum anymore.
Right.
So
I love how you're collaborating with the teacher, planning together. This is where I think we need to go in terms of most related services, instead of the model that we've been using for so many years, because I do think we're very valuable in the classroom, but we're not being used to. I'm a PT, but especially OTs, I do not think you're being used to your full potential. And then they just keep coming saying, can you evaluate this kid? Can you evaluate that kid? And whereas if everybody's working together in the classroom, it may be more effective for the student. So it sounds like you're really going down that path of teamwork for, for what's best for this classroom and the students in there. That's excellent.
Thank you. I'm trying, and I also insist that when it's time for an IEP, the teacher and I sit down and we write the present levels together, because I support the goals.
Right.
Not an OT goal. And so many people are like, we've heard you say that so many times. I said, I know, but you're going to hear me say it again and again and again, because there are no OT goals. There are no PT goals. And I emphasize that as well for the PT I work with. We do not stand alone. And it's
a hard concept. I think there's people, everybody does something different, and to take on that approach to it is an excellent one, but it is a hard concept. Just like you said, it was hard to go from a medical model to an educational model. It's hard for us to recognize, okay, I shouldn't have standalone goals. I should be supporting the educational curriculum. It makes it so much more educationally relevant right out of the gate, because we tend to write more medically based goals sometimes when we do write our own goals.
Right. Well, and one of our lead therapists / we have an IST OTPT now who goes in with all the ISTs for their meetings.
Instructional support team.
Yes. Who then also can reemphasize this to all of the other instructional support teachers for all the schools. Remember, there are no OT/PT goals, and she keeps, and bringing up many other aspects, which has been very helpful for all the OTs and PTs on our support side. But she came up with a little template for writing goals and helping teachers to write goals. And the goal itself must state that basically to support to increase their ability to access the curriculum. Grace must be in the goal, because otherwise there's no reason for us to have it.
Right.
she also has a statement that says that fine motor and gross motor impairments, unlike reading and writing, do not necessitate the need for OT or PT involvement unless it inhibits their ability to access the curriculum.
Right.
And
When you're including that in every single goal, I would assume it's very effective education to all the staff and the teacher and the parents, so that they're constantly getting this same message. If it's affecting education, we're here to support them. If not, that's not our role right now.
Right, exactly. Yeah. It is. It's very helpful. And I bring these things to every meeting and I repeat it again. And in the cert that we use, this rubric, there's a statement that says these services of a skilled OT and PT may often be best utilized through strategies provided to the teachers and staff, as opposed to direct
100%. 100%.
And before I use the cert, I state that every time. And I promise it, you're going to hear me read this again, and you'll hear me every time. But it's very important that you hear this and understand. If you don't understand what I'm saying, please stop me and ask me.
Right.
And because I want parents to understand that what I do is just a little bit, but these people are with your child every day, all the time. And my 30 minutes it's not going to change it.
Yeah. You're 100% correct. I agree completely with you. And I like the steps you're taking because, like I said, your skill set is so valuable to educate everybody how this is really a better model for students' success.
And I want to be in the classroom because the teachers have to know what I'm doing.
Right. To observe you.
To do it, to be able to carry over what I'm doing. And I'm one of those individuals who I have never seen a pencil grip fix a grasp. I've seen,
and it sounds like you've had a lot of years of observing whether that's going to work or not. No offense,
right.
You're coming with a valuable opinion there.
I've seen kids lose pencil grips. I've seen them use them as flying objects, but I've only seen where we can work on different strategies to fix a pencil grasp. And that I've been successful with. However, if I give a kid a pencil grasp, it doesn't work. So
yeah, interesting.
And I've focused pretty much all my career on handwriting and sensory and self-regulation. And it melded itself really well into the school system. And the other aspect that I do that I find most school therapists don't do is that self-regulation is a key component to accessing your curriculum.
To being ready to learn, 100%.
Ready to learn. And so many therapists that I have come across throughout my career have not understood that. And I think it's just because they don't understand what self-regulation really is, or that you can't use sensory integration in school. Well, you can. It's a strategy, it's a technique, but also fidgets aren't the answer to everything. Alternative seating is a better answer, many times. And there's many different ways that we can work on self-regulation besides a fidget.
Right. And using your sensory strategies, like you said, and we have there is a lot of research that supports that self-regulation can help improve academic outcomes long-term from kindergarten. When you see that self-regulation improving results in higher graduation rates, like these are foundational skills that you can use sensory strategies to help students be able to self-regulate. And I do think more and more people are becoming more informed on it since COVID and all of that lack of social interaction, I think has brought it out of the woodwork because we're seeing it more.
Yes.
But it sounds like you had made that connection years prior. You were ahead of the game there. We're going to wrap up in a minute. I do have one more question for you out of curiosity, and I could keep talking to you. Out of all the trainings that you've had, you've talked about being SIP certified and Linda Mood Bell and everything there. Craniosacral. Is there one that you found really impacts your day-to-day skill set as an OT? In the schools. How about I add that on there?
Well, I couldn't pick one out. I think I
Okay.
used them all collectively. I don't think that the SIP testing tool itself is useful in the schools because I can't use that. But I can't discredit that because it gave me so much background for the neuro processing and understanding what happens. But there's so many aspects, and unfortunately, our guru Reggie Bain is no longer around. And I would say, and I didn't mention them, but all of the Reggie Bain classes that I went to were such a foundation for so much of what I do. And then the Janetta Burpee class that I went to was another one that I still go back to those manuals from however many years back and tap into those because they still have so much foundation. And I still remember Reggie Bain taking one finger of mine and getting me to stand up just through a little bit of motion from a straight, flat on my back, laying down, not moving, literally one finger. And she managed to pull me to a standing just by facilitation.
Right.
And that kind of a thing, I have to take myself back to that at times when I can't get a kid to do something and just stop what's happening. And let me go back though, I just thought of it. I did a lot of photography and I've always done photography. And I've always told my students to work with a child, you need to have the eyes of a lens. You need to be a zoom lens. You need to zoom in and out and look back and forth as to what is happening. Why is this not happening? If something's not, pull back, look at the child from a whole, then zoom in on what you're seeing is stuck, and then pull back. And then the one thing that Reggie Bain always said was, if it works, it's therapy. If it doesn't, it's an assessment of what is going on. And
very
that
true.
Me up
very true.
Ever making a mistake. So that would be it. My last, But this
excellent.
This
was awesome. This was so great. I'm loving these interviews. So you'll have to go back. I posted the first one, a special ed teacher, and hers was really interesting too. She works with middle school students and a lot of collaboration, just like you were mentioning. So you might get some ideas from her. But this was excellent. I can't wait to post yours because, your sentiments, I think, will resonate with a lot of people, and your breadth of experience is amazing.
I don't see myself retiring for another 10, 15 years at least. And
that's excellent. No, it shows you love your job.
I love what I do. Yeah.
Yeah. Excellent.
So,
well, thank you very much. I really appreciate your time. And this was a pleasure.
Thank you for joining your therapy source for this Day in the Life series hosted by Margaret Rice. Visit yourtherapysource.com for more information to help students succeed.